いします。カレンさんはいつ頃から病院の中で施術を始めたんでしょうか。
When did you first begin working with hospital patients?
1999.
それはどういう経緯で始められたんでしょうか。
And how did that all come about?
I was working as a nurse in cardiac rehabilitation, and the hospital where I worked, the North Shore Medical Center, had a Reiki practitioner who left after 3 months because there was not enough people wanting to have Reiki. And my director there knew that I had been taking Reiki classes and asked if I would like to offer Reiki there, but I had to be at least a level 2 Reiki practitioner. So I went and took the extra training and began to see patients as part of their cardiac risk factor reduction program. And after just a few months, realized I didn't know enough to be offering Reiki to patients. So I went on to do the Reiki master training. And I worked there from 1999 to 2011. Initially outpatient, and patients would come and pay out of pocket for an hour session. And then it moved into an inpatient program where patients could have Reiki before and after surgery.
Okay.
And also in the rehabilitation setting, the women's health care setting, and the cancer setting. It varied from situation to situation. If it was an outpatient private session, it was 1 hour in a private room, an office, with a table and soft light, soft music. If it was before surgery, then I would be positioned wherever it was appropriate. So sometimes maybe it was just at the foot, and for the whole operating room case, just holding the foot. If it was when they were admitted to the hospital, after surgery or before surgery, then I would go to their patient room and frequently do head to toe, a full Reiki session, just on one side, no flipping over. And then in the cancer setting, sometimes it would be before or after they had their radiation treatment. So it might be 5-10 minutes seated in a chair. If they were receiving chemotherapy, then they're in a recliner typically, so it might be 15-20 minutes while they're reclining.
Okay.
Very positive, and it varied from person to person, but generally positive, and they would report feeling calmer, more comfortable, a greater sense of hope, particularly in the oncology setting, so peaceful, a sense of inner peace. Some of the cancer patients would express, "You don't know how much this Reiki means to me."
Okay, that's lovely.
一月にですね、何人ぐらいの方に施術をしますか？
Well, in the beginning it was still quite low, maybe 3-4 a month, and then it increased to 3 or 4 a week. And in the end, my last position was at the Mass General Hospital Cancer Center, and I would see about 10 patients a day, and I was there 3 days a week. And there it was as a part-time benefited staff.
Okay.
それで病気のせいでですね、何か拒絶反応があったとか、そういう経験はお持ちでしょうか？
I have not. Sometimes maybe a neutral experience, if they weren't that familiar with Reiki, didn't know what to expect, maybe they didn't notice a lot, but sometimes we know that they may not experience it on a physical level, but maybe it's helping them more on a mental, emotional, or spiritual level, and maybe they don't understand the results at the time. So, but generally they would have a response of drifting asleep, oftentimes a deep sleep for even up to an hour or two.
Okay.
ありがとうございます。それでですね、その施術は主治医の許可を得た上で行うんでしょうか？
It depended on the situation. Most of the time we had a policy in place that if a patient asked for Reiki, we had the privilege to offer them Reiki. There was a few cases, I was working for the neurosurgery office, and the doctors would actually prescribe Reiki. 1998, and I first learned of Reiki at a nursing conference, and there was a woman speaking about Reiki and talking about how it promotes self-healing and boosts energy, and I was feeling at the time a little bit low energy and was looking for a possible change in my job career. I'd been working many years in the intensive care as a nurse, so I decided to try a session. Another woman had a booth there, and I set up an appointment with her, and the first session I had was such a profound relaxation that I drifted and was not aware of the session, not aware of her. An hour passed, it seemed like minutes, and I felt a sense of relief, like a weight was lifted, and I said, why aren't we doing this in hospitals? That was amazing.
Okay.
So from that point, I made it my mission to help bring Reiki into mainstream healthcare. It varies again from place to place. There's a great deal of awareness about it now, and some places offer it more and people will receive it more. Some places it's still coming into acceptance. But what's interesting is when I first would give a lecture about Reiki and I would ask how many here have had Reiki before, maybe 1 or 2 hands would go up. And now I say how many people have heard of or had Reiki, everyone's hand goes up. So that was 2009, and until recently I didn't really realize that they were using Reiki in the military. I was mostly focused on Reiki in hospitals. So I started looking into it, and it turns out that even as far back as 2006, there was some publications about the use of Reiki in hospitals for stress reduction, stress relief, and potentially the treatment of post-traumatic stress disorder, PTSD. So I started making some phone calls. I got connected with the Boston Commissioner of Veterans Affairs. He offered me some other contacts, and I'm finding it's being used more than I realized and starting to be studied more in that setting as well. Oh, it's hard to describe, isn't it?
Yes.
It's something that you have to almost experience it to understand how it gives this sense of peace and well-being, and I'm generally more relaxed, generally happier, because I have this ability to, at any given moment, bring peace and calmness to myself. Well, my goal from the beginning to now, from that first session in April of 1998, when I said, why aren't we doing Reiki in hospitals? My vision is it will be in hospitals every day, all shifts, where somebody can call the Reiki practitioner on a pager and say, this patient needs Reiki. At Mass General, I carried a pager, and the staff, when a patient needed Reiki or wanted Reiki, they would page me to come see the patient. To me, that's ideal, to have a paid provider on staff, just like any other paid provider, physicians, nurses, occupational therapists, physical therapists, dietitians. They're all paid professionals, and when they're needed, they're called. So I see that for the Reiki provider.
Okay. Wow.
どうもありがとうございます。
Thank you.
Thank you.